Hello, I'm Andrew Coughlin and welcome to this online presentation about hip dysplasia in dogs. In my experience, when hip dysplasia is diagnosed, the first thing you want to know is my dog going to be okay? We know hip dysplasia can cause some serious problems, and so naturally we can fear the worst. Hopefully I can reassure you that most patients with hip dysplasia can lead happy, good quality lives. So what is the best treatment? Well, this depends. In many cases, believe it or not, no treatment is required, or at least not much, maybe a course of anti-inflammatories for a week or two to settle things down. Some patients, however, may require surgery. Hip dysplasia isn't a static problem. It's a changeable condition, and I think to be able to help your pet in the best way, it's extremely useful to understand a few things about the condition. I have heard a lot of people talk about hip dysplasia and get very confused, so let's be clear about what hip dysplasia is. Okay, pretty basic I know, but it's a condition of the hip joint, and the canine hip joint is situated here. It's a ball and socket joint. The ball part is the femoral head, which sits at the top of the thigh bone or femur. The socket is a part of the pelvic bones known as the acetabulum. This illustration shows the bones around the left hip of a dog. Here is the femoral head, and it's sat inside the acetabulum. Now the term dysplasia means abnormal development. So in hip dysplasia, we have an abnormal development of the hip joint. Hip dysplasia is a heritable condition, and so it can be passed on from parent to offspring. Some dogs can in fact carry the genetic blueprint for hip dysplasia, but have relatively normal hips. Now, although the risk factors for the development of hip dysplasia are passed on from parent to offspring, environmental factors such as diet, whether or not the puppy is a male or a female, and the amount and type of exercise they have during growth can all affect how the hip ends up. Another important factor is that puppies are not born with abnormal hips, but rather the hip develops abnormally during their growth. At 3 months of age, the hips from a puppy destined to have hip dysplasia will look very similar to those from a puppy who is not. Understanding how the dysplastic hip develops will greatly help you to understand why a particular type of treatment may be recommended or considered helpful to one patient, but not to another. One of the first identified changes in a hip that's going to become dysplastic is a looseness or laxity in the soft tissues around the hip joint. In the normal hip joint, the femoral head sits deep in the acetabulum. When the leg takes weight during normal activity such as running, jumping and playing, the joint is held tightly in position and the load is shared evenly over the whole joint surface. The laxity of the joint that occurs in hip dysplasia allows the femoral head to keep popping in and out. In other words, it partially dislocates during walking and running and playing. We call this partial dislocation a subluxation. When the femoral head falls back into place, you will sometimes hear a click or a louder clunking sound. This can be extremely alarming for pet owners, but it doesn't usually appear to be painful for your dog. You may even hear this clunk when the puppy rolls on its back or when it gets up from lying down. So why is this laxity in the hip bad? Well, the movement of the femoral head means that all the weight is concentrated on the weaker rim of the joint rather than in the solid center of the joint where it's supposed to be. So all the weight-bearing forces get concentrated on a relatively weak area of bone. This causes small cracks and tiny fractures to occur in the bone. These events then lead to the hip starting to change shape. With all the extra weight and pressure that is put on the acetabular rim by the partially dislocated femoral head, the acetabular rim basically starts to get worn away. Now, in addition, the skeleton comes with a genetic blueprint for the approximate shape of all its bones, but the fine-tuning occurs as they react to the demands placed upon them. so the acetabulum won't develop properly. We won't get a nice deep socket because it's not being used like it should be. This tends to become more pronounced as the puppy grows. And like the acetabulum, the femoral head is not taking the body weight over its whole surface, but more on one side. And it too gradually changes shape and ends up looking more like a mushroom than a round ball. This then is the dysplastic or malformed hip. Now, X-rays are an important tool in the diagnosis of hip dysplasia, so let's look at some. On the left we have a normal hip. Notice the nice deep socket with the femoral head sat inside it. By contrast, on the right we have a puppy with early hip dysplasia. Notice how the femoral head is sat outside the socket. However, at this stage the femoral head and the acetabulum look relatively normal. It's just that the hip is well loose and there's laxity there, allowing the femoral head to sit outside the socket. Now this X-ray could be from exactly the same dog that we've just looked at, but a few months later. Notice how the acetabulum has now become very shallow, and the femoral head is much more angular in shape, and it does look more like a mushroom than a round ball. So why and when is hip dysplasia painful? Let's plot a chart showing the degree of discomfort experienced by the patient on the left axis against the age of the puppy shown along the bottom. And let's consider this for, say, the first 1 to 2 years of life. Imagine that the red line shows the point at which the hip becomes sufficiently painful to cause lameness, or another clinical sign associated with hip dysplasia, such as difficulty getting up after rest or difficulty jumping into your car. In other words, the point at which we see clinical signs of hip dysplasia. And we'll think of this as the red zone on the chart. Now, some puppies will have hip dysplasia but never cross that line. The hip remains what we call subclinical. The dog has hip dysplasia, but it isn't really causing much discomfort, and either we're not aware that the puppy even has hip dysplasia, or if we are, it certainly doesn't seem to need any treatment. Other puppies will show quite severe hip discomfort, and this is due to the tiny fractures that are occurring in the acetabular rim, and also to the excessive stretching of the soft tissues around the hip as the femoral head pops in and out. In many of these patients, the clinical signs will settle over the next few months so that by 12 to 15 months of age, they are relatively symptom-free. Some medical treatment may have been required, such as a course of anti-inflammatory drugs, and physiotherapy and hydrotherapy may also have helped. Now, in some dogs, this pain never really settles down, and it continues into the second year of life, and it may even start to get worse again. Indeed, this is what we might consider to be a second phase of discomfort associated with hip dysplasia, and it can actually occur at any time in adulthood. It may only appear when the dog is much older, say 9 or 10. And the reason for this second phase of discomfort is the development of arthritis, or more specifically osteoarthritis, in the dysplastic hip. The X-ray on the left shows the dysplastic hip we looked at earlier, and the picture on the right shows the same hip after the development of osteoarthritis. Bony lumps and bumps called osteophytes have developed around the joint. So let's summarize some key points about hip dysplasia. Firstly, hip dysplasia is a developmental condition, with the hip shape becoming progressively more abnormal as the animal grows. The severity of the hip changes is variable, and the degree of lameness and disability caused by hip dysplasia is also very variable and quite difficult to predict. Hip dysplasia causes osteoarthritis to develop in the hip joint, which can cause further problems for the patient. If you'd like to find out more about osteoarthritis in the dog, about joint structure, some of the drugs that are used, and the various treatments of osteoarthritis, you can get a complete free video series at arthritisdogs.net. Thank you for listening, and I hope this has been a useful presentation for you, and has helped you to understand more about hip dysplasia in dogs. We're planning a second video about treatment options, so if you think this would be a good idea, please like us on Facebook, send us a comment, and perhaps share this video with your friends if you think it would help them. Bye for now.